So hi Ian, Dr. Nikita Vizniak.
Ian.
Nice to meet you, sir. So today we're going to go through a basic patient history as though you might do in real practice, and Ian's got a real injury that we're going to work on, and it's going to be a fantastic learning experience for everybody. So, all right Ian, so what brings you in today?
Basically was playing lacrosse today and got a pass, and the defender was basically right there and put me on my rear.
Yeah. So was it a check, or did a ball hit you, or what happened exactly?
It was I think it was a shoulder into my ribs.
Yep. So like top of the shoulder, probably that part right there.
Yeah, I think so.
Yeah. Okay.
Yeah, I just kind of turned and saw him, and then I was laying down.
Yep. I've had lots of those. Yeah, exactly right. Yeah. And okay. Yeah. All right. So you say you've got point tenderness right there. So yeah, you can point at it.
Just kind of right in that area there.
Okay, and is it over top of the ribs, or is it more like in between the ribs?
I think it's more in between.
In between the ribs. Did you hear any snapping or popping at the time of injury?
No. Just when I kind of got up, I thought I felt some movement. Like it felt just like it felt like more like ligaments moving, rather than anything broken, and there was no super sharp pain, and breathing wasn't a big issue.
Okay, so you can tell Ian is a fairly educated patient. Number one, he knows what a broken rib would feel like, right? Typically, it's going to be a sharp shooting pain with breathing, like you knew right away, right? Yeah. And there was another interesting thing you said previously too, that when you've broken bones before, what have you noticed?
I get nauseous.
Yeah, and you don't have any feelings of nausea or anything like that. And so you didn't hear any snapping or popping. When did this actually happen?
It was about... I'm going to say 1 o'clock.
Yeah, so just today it happened, right?
Yeah.
So not even 5 hours ago.
Yeah.
All right, if you were to describe the pain, how would you describe it?
When it first happened, it really wasn't painful, and then the first thing I noticed was kind of felt like cramping.
Yep.
And then as the time went on, probably an hour and a half later, it started to get painful, like if I kind of reached down or if I picked up something. Yep. It got more severe.
Okay. And is the pain only right there, or do you notice anywhere else?
I started noticing once again, maybe 2 hours later, I started noticing it in my back.
Yeah.
And I've had a similar situation happen before, and that was the same result.
All right. On a scale from 0 to 10, how would you rate the pain with this one?
It's probably 5.
Probably a 5?
Yeah.
Okay. And at the time you were hit, what would you say it was at? Did it knock the wind out of you?
Yeah, a little bit.
Yeah, totally, right? Yeah. We've all been there. It's all right. Okay. Yeah. Okay. What makes it feel better?
Not doing stuff.
Yeah, exactly, right? Not moving around, for sure. It's interesting, before you said too, like it feels like it's been pushed back at the back a little bit. What did you do for treatment previously?
I actually went to a naturopath chiropractor.
Yeah. All right, so just an adjustment, and it went away right away previously? Yeah, and that's why we're here. Okay, what are you doing that makes it feel worse?
Kind of lift it. If I lift something, that's the big one.
Yeah.
If not so much driving, like if I'm driving, it was fine. If somebody else was driving,
and
you're not
ready
for the movement of the car.
All right, and making it feel better?
I did put some ice on it. That didn't seem to help a lot.
Yeah.
All
right.
And it's like just kind of like sitting in a good posture seems to help.
Yeah.
But if I reach down to like tie my shoes or something like that,
with any kind of twist into it, right?
Yeah.
So you're kind of more engaged when you're in a good posture too, right? Making your own brace through the abdomen there. So yeah. All right. Cool. Okay. Any numbness or tingling with it?
No.
Okay. And are you taking any medications?
No.
Nope. And have you had anything like this before? You said previously you had?
Yeah, it's been quite a while.
Yeah.
2 years ago, I think.
It's been a while since your son has set you up with a bad pass. So you get, all right. All right. Is there anything else you want to add that you think I haven't asked about, or that you want to suggest I should be aware of?
My neck's a little bit tight.
Okay.
I did get a hit a couple of games back, just in the back of the head. Took some anti-inflammatories and went through concussion protocol just to make sure.
And concussion protocol, what came out of that for you?
It's possibility.
Yeah, but like low level, very unlikely. Yeah. You didn't have any confusion, no stars, nothing like that. Yeah. All right. Okay. Well, we can have a look at that for you too. Okay. I guess that's all I'm going to do right here. So if you want, I wouldn't mind just moving on to more of the physical exam portion. The history still continues all the way through this, of course, but we just want to make sure we've covered all our bases before we actually start our treatment.
Yeah.
Is it okay if we just pop up the side of your shirt just to see if there's any bruising or swelling there? Yeah. And this right back here, that's not where it is, right? There's just, you have a little bit of a birthmark right there. No pain or tenderness or any of that?
No.
Nope. Why don't you point to exactly where you feel the most of it? Yeah.
After.
Yeah, exactly, right?
Right there.
Yeah. Okay. So I'm going to do the same thing. I'm just going to push my way around it. If it's too much, let me know. If I flex your ribs like this, that's okay?
Yeah. You know, it's a little bit, like it's tender, but it's not sharp.
Yeah, exactly, right? So if this was a broken rib, I've had broken ribs before too, you know what happens.
Yeah.
As soon as I do this, it lights you up right away, right? So we've pretty much ruled out a broken rib in this case, so we can go ahead and proceed with our basic protocols. Because we're always teaching and learning at the same time. So, Ian, it looks like that you might have a subluxation and some muscle spasm over top of your intercostal muscles on this side. Okay. That's typical following, and you know all about this, right? Okay, and I also think that you have a rib that's out, which you basically know already too, having had this before.
Yeah.
We'll assess your neck at the same time, but I can already tell just from the range of motion limitation that it's the same thing there. You've got some muscle tightness and stiffness that we want to work through. So, options for treatment. Procedures that I'd like to do is we can definitely adjust. I can do some soft tissue stretching if you would like.
Right.
Alternatives, we could just put some heat on it and you could stretch yourself if you wanted. Risks, sometimes people have a little bit of soreness following it. Usually that's not very common, but something I have to throw out there. Do you have any questions before we proceed?
No, I'm comfortable having adjusted if that.
So I don't expect this is going to go away with just this one treatment, but I will expect we're going to set up the conditions for better healing because we're going to align your bones a little bit better, right? Give you some better mobility here with this. Yeah. So I'll get you down the table just a little bit, even if you can. It's kind of the max height for my table. Give yourself a big hug like this. Have you been adjusted like this before? Yeah, and we'll have this leg up just so you can balance your foot there. And what I'm going to do is I'm going to have you do a little bit of a sit-up, and you're going to look that direction, okay? So you're going to come all the way up as much as you can. Yep. And how's that? Are you okay?
That's okay there.
Yep. Yeah. Okay, just go ahead and relax your body for me if you can. And then all the way out. Yep, a little shift right there. Perfect. That's all we want to do for that one.
Okay.
I don't want to push it too much. You could feel it shift right there when we did it. Okay, next thing I'll do is we'll go ahead and look at your neck here as well because that was something that you brought up. So, hands are nice and relaxed. You can go ahead and put your foot down. Ideally, we could also put some heat over top of it before you were adjusted, or I'm sure you're doing that after games maybe too.
Yeah.
Like when you got some neck tightness like you do here. Yeah, definitely some heat is going to be a benefit for you. Yeah. You got a thicker neck, so it protects you in the game, that's for sure, but it winds up limiting your range. And you can actually feel this side feels a little bit better than the other side. Yeah. All right, and you've been adjusted with your neck before as well, so you understand that's the same sound as cracking your knuckles, just closer to your ears. Professional move, always tuck your tie in. And heavy head for me. Nice. Fairly precise. All right, let's get you to sit back up though. I'll give you a hand up here. Yeah. And it's still gonna be sore.
Yeah, for sure.
Yeah, but I want you to move your neck around a little bit for me and just see how it moves again. Yeah, and you can already see that's a little bit looser, a little bit better range right there. And then what if you just take and tilt your body from side to side here a little bit? Yeah. Okay, perfect. I like that mobility that I'm seeing right there. Nice. Yeah. All right, so that would take us through a basic initial visit right there. One of the key things you don't want to do in any patient visit is you don't want to over-treat, right? Like the worst thing I could do, you've already been hit hard right there. What does an adjustment include? It includes fairly hard hits that can happen in that area. If you notice the way that I adjusted, I was very specific. We only had 1 or 2 cavitations at each location, and I just want to leave it like that for the first visit. Typically, what are you going to do? We'll follow this up with a second visit or third visit and see how he's doing with that over time, and just make sure he keeps on moving the area around. And if symptoms should get worse, like if you should start to notice a sharp pain, I know for myself, I've been checked like that before. You get the top of the shoulder right into your ribs. You feel it, but it's not too bad. But I can remember one time I actually had a cough at the same time, and because I was coughing, that repetitive cough, cough, cough actually snapped the rib eventually.
Oh, okay. Wow.
So you got to, number one, protect the area. Yeah. So you want to make sure that you watch that you don't get checked that way again, or that you're more conscious of it. Right. Yeah, and that would be the kind of key thing right there, right? Okay. It's at least for the next, probably 3 weeks kind of thing.
Right.
Yeah. So no more crap passes, right? All right. Yeah. And then the other thing would be, I would suggest you to switch over to heat onto it, because what's heat going to do for you? Initially, cold is good. It can be analgesic, but heat actually increases reaction rates, and it just tends to be more analgesic for people, and you can move around. So whether it's a hot pack or whether you're in the shower or something and moving around, challenge that tissue a little bit.
Right.
If you don't challenge it, we get fibrosis and scar tissue, and that's what we want to kind of avoid with this kind of situation, right?
Yeah, I actually did have a fairly warm shower just when I got home. So that helped.
Yeah, okay.
It seemed to help.
Yeah, excellent.
Yeah, quite a bit.
Yeah. All right, Ian, do you have any other questions for me?
No, I think that's good.
Okay.
Really appreciate it.
All right, thank you, sir.
Thank you.
Okay.
Basically, I came in because I'd got an impact on my ribs and had dislocated the rib in the back, and you had helped me out, adjusted that, and it was actually feeling really good. And like right after, I was actually able to kind of run up some stairs, which surprised me. Just basically that surprised me. But we were in our lacrosse provincials that same weekend, and was really not planning to play, but after the treatment you gave me, I was kind of surprised how well it felt, and we were short of guys, and just started warming up, and everything just had kind of full range of motion again. Didn't really hurt, and then ended up playing 2 games. Probably not the brightest thing to do, but I was just amazed that I was actually able to compete and play. So fantastic job.
All right, cool. Thank you very much. That's all we're gonna get. Okay, excellent.